Thank you all for joining. I'm Justin Gandrud, a senior wealth advisor here at Prosperwell Financial. Connor Jones is with us as well. Blake Beaudry from Beaudry Hometown Insurance is with us here too to talk about Medicare. Um, do you two want to introduce yourselves at all to start?
Sure. I'm Connor. Like Justin said, I am an associate wealth advisor at Prosperwell. Been here for about 7 years, roughly. Justin's going to talk a little bit about what we do in just a second. Go ahead, Blake.
Yeah, and I'm Blake Beaudry from Beaudry Hometown Insurance. And again, as Justin said, I'll just be adding a little bit of the Medicare information to kind of tie along into Social Security. But yeah, that's pretty much it. Go ahead, Justin.
Why isn't it moving? There we go. Um, just to explain who we are, so it's not a question of why are we talking about Social Security. Prosperwell Financial, we do financial planning. So that's financial planning, investing, planning for retirement, meeting with clients, tax strategies, etc. So Social Security is a big part of everything that we talk about because it factors into so much, especially with retirement. So today we're just going to focus on Social Security, but every day it is a conversation in and out. So
Yeah, and so one of the main questions we get often is what does it take to qualify for Social Security? It's 10 working years. So every year you work, you get a quarter that goes towards Social Security. And then your benefits based on your 35 years of income. So your last few years of income can be some of the most important because they're generally your highest earning years. So they can knock off some of those earlier years of lower income. You're eligible to take your benefit at 62, and you're required to take it by 70. As we'll get into the next slide, full retirement age is 70 if you're born after 1960. Justin will touch on that a little bit. If you take a benefit immediately, you'll receive about 70% of it. Every year you defer it, it goes up to your full retirement age. If you defer it beyond full retirement age, towards 70, it goes a little bit more as well.
and here's a graph kind of referenced. If you haven't seen this before, which I assume a lot of you have, uh, typically you only have to see it once to know your age. And we're going to refer to it full retirement age as 67, but this has been the graduated scale for a long time now of what full retirement age is. We'll touch on this here in a moment, but honestly, this is one of the potential changes that's always talked about. As of now, this is how the rules sit for when full retirement age is.
So, retirement benefits for qualified family members, there's a couple of nuances here. Uh, Common question we get is if you are married, are you eligible for your spouse's benefit? Yes, if you've been married for at least 1 year, you're eligible for half of your spouse's benefit if it is higher than your own. If you are divorced, if you were married for 10 years, you're still eligible for half of your spouse's benefit, your ex-spouse's benefit. This one thing you want to be careful about is switching on between the two. That's something we talk to clients about, making sure that you're taking a full advantage of your benefit to make sure you're maximizing what you can get from the government and Social Security. A couple other things is children under the age of 16 that are disabled. You may be eligible to get Social Security benefits. There's a couple other ones underneath there too, if full-time students are disabled. But those are pretty specific, have to meet a couple of different things with the government to apply for those, but certainly things we can talk about or do talk about with clients.
Um, Earned income. So everyone's question, I should say, when we talk about Social Security is when should I take it? And there's a lot of factors in that question, but this is one of the most known things. I'll say, if not one of the biggest, if not the biggest factor we look at when as to when you should take Social Security is are you going to have earned income before that 67 or full retirement age by having earned income. This year it's 23,400 per year. If you earn more than that, you actually lose $1 for every $2 of benefit. So it typically doesn't make sense to take it early if you're still working and earning over $23,400 per year of working income. Yes, you get that back after Social Security, but you've now locked in a lower income of Social Security and you're taking a cut on it for the first however many years. So typically earned income is one of the biggest topics and factors, I'll say, that go into this calculation and the question of when should I take this? So this is just a graph showing what is considered earned income. I shouldn't say graph. A lot of words explaining what earned income is. It's employee income, W-2, 1099 self-employment income, and then anything else work-related, bonuses, commissions, fees. If any of these have a chance of being over that $23,500 number this year, and you're considering it, it's definitely something to wait if possible. Things that are not considered earned income are pensions, retirement accounts, retirement withdrawals, I'll say, workers' comp, unemployment compensation. If you win the lottery or the price is right, they do not count that as well. And you can see a few other things, tips, etc. So don't focus on the numbers too much here. We need to update this slide, but it shows what this looks like. So if you have $12,000 of income and $10,000 of earned income on the left-hand side there, you get both. If you have $20,000, and this is why I say don't focus on the numbers, but basically, if your income is over 23,500, it's going to start to reduce the amount of Social Security that you get. The far right-hand example is the concern of what we're watching out for. We don't want you to take it early, lock in a lower payout because you started it early, and then receive even less over time.
And so our goal as financial advisors, or as financial planning, as part of the financial plan, is helping clients with Social Security. You know, it's a piece of the pie, but it is one of the most important. It can help determine when you retire, as Justin alluded to earlier. So when you take it is a big deal. What's your monthly expenses come into that? But as you work, you'll save into different buckets and Social Security is one of them. So you have employer plans through work, potentially pensions, etc. But this is where we help clients first where their money's coming from in retirement and why are we taking from there from a tax standpoint, tax strategy, that kind of thing. And how does Social Security play into that, like Justin just mentioned with earned income. So there's a lot of buzzwords out there when you retire and prior, Roth conversion, non-retirement accounts, backdoor IRAs, mega backdoor Roth IRAs now, which are all good planning tools, but they're for specific situations. And so that's what we help clients with. We want to make sure, we work with estate planning and that it's in line with what you want. But again, this is what we do. We help our clients figure out where Social Security fits into that pie. And, it's like it says right here, it's about 33% of it. That's different for everyone. Everyone's situation is a little different. We can run different numbers to show how it would affect when you take it, how much you get, if it hits the break point, that kind of stuff. Want to move to the next one, Justin? So 4 common questions about Social Security. Will Social Security be around when you need it? Short answer is yes. We don't have a crystal ball, but if nothing is changed right now, benefits will be paid 100% through 2033 for participants that have enrolled in Social Security. If nothing changes after that, participants will receive about 75%, 70 to 80% of their benefit following 2033. There's a couple things that we think will do to fix that. It's a political question, but we can get into that a little bit more on an individual level. Again, we're not politicians, so we can't say when it's going to be fixed, but we do believe that it will be at some point. So if you're divorced, can you receive Social Security retirement benefits based on your former spouse's earning records? As we mentioned before, yes, you're eligible for up to half of it if you've been married for 10 years. if you delay receiving Social Security benefits, should you still sign up for Medicare at age 65? Blake's going to touch on that in just a second here. And will a retirement pension affect your Social Security benefit? Government pensions for fire and police, the answer is yes. They offset. And so that's something that we're always looking at too when we talk about this. If there's additional pensions, sometimes they can. So it's always part of the financial plan. We're trying to figure out if it does, but fire and police definitely they do offset. Go ahead, Justin, or go ahead, Blake, I should say.
All right. So yeah, kind of as Connor talked about, to tie in with those two is the Medicare piece. And that's the question that we are getting way more than we ever used to 5 years ago, even, or even 10. And the reason why there's so much confusion with it is because most people nowadays are working past 65. And so where that comes into play is typically if you're working, you might be covered on your group health plan, right? And so a lot of people are waiting to go on Medicare. Why that's kind of important is because Medicare, there's two parts that we've all heard. Um, I kind of joke with, Connor and Justin that Medicare is very confusing. You kind of got the whole alphabet of A, B, C, D, E, F, G. Um, and a lot of people just come in and it's so overwhelming and they've talked to other people or they've, done their own Google searches and it's so confusing of what they really need to do. So usually when I'm meeting with somebody that's even considering they're getting close to that Medicare age, the things we're talking about are one, are you going to keep working past 65? And will you be covered on a group plan? Um, and the other thing too would be is when you do want to go on Medicare, what you need to do in order for that to happen. Um, so like Justin and Connor were talking about is again, if you're not taking Medicare before your full retirement age of 67, and you do want to start Medicare at 65, you do need to enroll yourself. It won't happen automatically. You need to sign into your you can do it a couple ways. You can either sign into your Social Security account online, or make an appointment with the Social Security office. There's one in Brooklyn, is it Center, Brooklyn Park, Brooklyn Center, and then St. Cloud has an office as well. You can set up an appointment with them. Um, but so let's take it from the side of you're going to keep working. Part A for most people is going to happen automatically when you're 65, and it ties in with Social Security as well, is that there's not a charge for that for most people as long as you've worked the 10 years or 40 quarters like Connor had mentioned. Um, it's the Part B portion that there's a charge to that. So that's where if you're going to keep working, you can delay that. Otherwise, if you select for Part B, you're going to get a bill for that Part B. And what it is that they basically will charge you for 3 months at a time. So you're going to be paying that quarterly. In 2025, the Part B monthly premium is about 185. And that's going up to 206.50. So if you don't need your Part B, you're covered on a group plan, then you can avoid paying that expense as long as you don't need the coverage. And then just the other thing is what you need. So the other thing we get a lot of people that are stressed out is because there's so many buzzwords about, if I don't do it by this time, I'm going to get a penalty. And, a lot of people are concerned. I just don't want to screw this up. And there is truth there, are penalties based on if you're not signing up in time. But again, as long as you're just, if you're covered on a group plan and you talk to an agent before that plan is going to run up, or if you do need to start at 65, just talk to an agent about 3 months prior to your 65th birthday, and they can walk you through making sure you have your Part A and Part B in place, and then getting you in the correct plan that you need to avoid any potential penalties. And that can happen whether you're 65. Now it's not uncommon for us for people to sign up for Medicare at 68, 69, or 70 even. And all those people can avoid the penalty as long as they're covered on a group plan. So it is confusing. There's a lot of moving parts, and now more than ever, it's really individualized. Because not everybody is taking Medicare at 65, kind of like with Social Security. Not everyone's doing that anymore. They're kind of waiting until their full retirement. So just knowing that the big things are, if you have to sign up yourself, it won't happen automatically if you're not taking Social Security for that Part A and Part B. And then making sure how to avoid those penalties is making sure that you have credible coverage from your employer. And so really all that is, it's talking to your HR, getting something that says Blake was covered on our group plan through whatever month of year. And then when we go to apply for Medicare, you'll give them that. And so then you will avoid that penalty. A lot of questions on that. I know that can be confusing, but usually when we sit down and kind of walk through that individually, it starts to make more sense for people. But just kind of be aware of those dates of, do you need Medicare exactly at 65? Again, it just depends on if you're still working and or covered on a spouse plan that they might be if you're getting your benefits through a spouse that is covering the health benefits. So a lot of moving parts there, but that's kind of the high level of Medicare, just on when to sign up and what penalties. And then once you get that set up, then you'd want to meet with an agent to talk about what do I need to go, kind of go with the original Medicare Part A and B. Again, you're going to hear a lot of letters out there. It's a lot of, I always tell people to not focus so much on that, to talk with an agent, to just get a plan that you're comfortable with that'll fill in the gaps that you need. So again, high level of Medicare, reach out with any questions. Happy to help answer anyone that has those questions and walk you through and make it more specific to your situation. So with that, I'll throw it back to Connor and Justin.
Thank you, Blake. I was going to reiterate the same thing. Obviously, we love to talk about this stuff. We know probably more than we want to some days. That's part of our job. As Blake alluded to, we want to be there to help people so that you only have to think about this once. Don't regret your choices. Set it, and it's there forever. I mean, if it's not with us, work with somebody you trust, somebody you know. Make sure that you're making the right decisions because you really get one shot at this, and we don't want to pay extra penalties. On our side of things, Medicare and Social Security plays such a big role in retirement that it has to be talked about. So that's why we want to give a brief summary of some of the big things we're looking at, but we're happy to go more in detail. If we knew when everybody was going to pass away, this would be an easy question of when to take it and how much to get out. Unfortunately, or fortunately, we do not know that. So earned income, taxes, other retirement accounts, when to start Medicare, all these factors play together to try to pay as little as possible in taxes and get the most out of the benefit for your situation. So with that, if there's any questions, feel free to reach out. I will leave this up here for a moment. Here's our contact information and a QR code. I know we need to add Blake's information to this, but if you would like it, feel free to reach out and we are happy to pass it on. So anything else, Blake, Connor, that you wanted to add?
The only thing I was going to say too is just if, as a reminder, if you don't have a Social Security account set up online to get one of those, that'll be probably the easiest way for you to get everything set up. But that's the only thing I've noticed when I talk to people is some people have already created that account, some haven't, and it's just going to make your life a lot easier if you already have that account set up when you need to go enroll in your Part B or whatnot.
Right.
Or Social Security.
There
SS
is.
is
Go
the
ahead,
website.
Justin.
SSA.gov is the website. And don't wait till the day before you turn 65.
Yeah. Right.
There is a Q&A button on the bottom there too. So if you do have any questions, you can certainly type in a question. We can address it as well.